Hey guys, welcome back to Medical Coding with Blue on Patreon. Okay, so as I promised a few days ago, I am going over the life cycle of injury diagnosis coding slides with you all. This was a presentation that I had done for the AAPC local chapter in Augusta, Georgia. This was my first time doing a slide deck for a speaking engagement like this. I typically do not as many slides. This is 51 slides. And technically this isn't even the last draft one, but I typically don't make the slides this long when I'm educating my providers because of the simple fact that I get 1 hour with them. And in that 1 hour time, I want to be able to have them be able to ask questions. I don't want them to get frustrated looking at something that has so many pages. So don't get the idea that this is how I do all of my presentations, okay? This was only because I looked at the requirements for AAPC and how they like for their CEU presentations to be done. And I knew that they were going to get CEUs for this. The president didn't ask me, the area president didn't ask me to do it, but I went ahead and did it this way because I want to kind of get into that feel of what it's like to do presentations that are going to earn CEUs. So that's why I did it this way. You can follow along with me as I read these. I'm going to stop and talk about what I mean during this, so it may turn into 2 episodes. I don't know. We'll see. But I'm going to go ahead and read you guys the disclaimer and the copyright. I always do this even on my my own slides that I do for my providers, so just so that it's all there. So the disclaimer is, disclaimer, the content of this presentation was current at the time it was published or uploaded to the web. This presentation was prepared as a general educational service to the public and is not intended to grant rights or impose obligations. This presentation may contain references or links to statutes, regulations, or other policy materials. The information provided is only intended to be a general summary. It is not intended to take the place of either written law or regulations. I encourage readers to review the specific statutes, regulations, and other interpretive materials for a full and accurate statement of their contents. The ICD-10-CM codes are copyright 2020 by the World Health Organization. What is an injury? An injury is when something happens to the patient. Injuries can occur in many forms: car accidents, assaults, falls, lacerations, to name a few. Complete documentation of injuries is critical for accurate code selection as well as for statistical purposes and for resource management. What is an organic condition? An organic condition refers to a natural body reaction such as pain. This can potentially signal a developing or degenerative condition. This is different from being injured. Yes, injuries can produce pain, but it is more important to know the difference when coding to ensure correct code selection. I'm going to stop it right here. I have seen coders say that the patient came in, their chief complaint is right arm pain. And then when you're looking in the history of present illness, they're saying that they were roller skating, they fell and hit their arm when they fell on the pavement, right? And then of course, when they go to do their x-ray, sometimes they can't see the extent of these injuries. So the provider will say that they're going to go ahead and splint the patient, and they're going to give them some over-the-counter medication for right now, just to see if that can hold them over for a couple of days while the swelling goes down, so they can see the extent of the injuries. Because not all fractures show up right away on an x-ray. Sometimes really bad sprains, you can't tell the extent until the swelling goes down. So because of this, some coders will say, oh, well, I'm only going to code the pain. No, they came in because of an injury. And I'll get into unspecified injuries at the end of the presentation, but I wanted to go ahead and make that clear that there are 2 separate things. A patient can wake up with pain, and that's something organic because they didn't have anything happen to them, right? Nothing happened to them. They just woke up with pain. And we don't know if that could be signaling like osteoporosis, or if it could be signaling just, pain in general, maybe osteoarthritis. So those are different types of pain, okay? Pain, again, can come from nowhere, or it can come from an injury. So I wanted to make that clear. Information needed for initial reporting of injuries. The date of injury. What was the injury? What side of the injury, if it was a limb? how the injury occurred so we can get an external cause, the activity, the place of occurrence, and the status, if they were doing this for work, if they were a student, etc. FYI on initial reporting of injuries. The Y code, the activity, place of occurrence, and status codes are only reported once in the medical record. These codes are always reported after the external cause codes. The code Y92.9, unspecified place or not applicable, is not used if the place is not stated or applicable in the encounter, right? Do not assign Y93.9, unspecified activity, if the activity is not specified. And do not assign Y99.9, unspecified external cause, if the external cause is not stated. The external status, is not stated. A for active treatment. From the ICD-10-CM Coding Guidelines, Chapter 19, Section A. 7th character A, initial encounter, is used for each encounter where the patient is receiving active treatment for a condition. When a patient is receiving initial or active treatment, they are not in the healing phase of their care yet. However, they can be seen by a new provider for their injury while in the healing phase, and this would not be considered initial if the provider does not perform new restorative treatment. So what I mean by this is there's going to be an example in here that's talking about what it's like when a patient has a restorative treatment done in the ER and then they show up in the orthopedic clinic, and I will get to that when we get there. Examples of 7th character A application: assessment and diagnosis of an acute injury and definitive treatment being performed, such as fracture reduction or a suture repair. Non-unions or malunions that occur when a patient delays seeking treatment for a fracture. So if they never showed up, and say for instance they hurt themselves 2 months ago, never went to the doctor, never did anything, basically tried to ignore the pain, and then they couldn't take it anymore, and they come in and now they have a malunion because they had a fracture, they never had it treated. This would be considered A for active treatment, okay? This is different from when a patient is already receiving treatment and then they have a malunion or non-union because of their treatment. That's something completely different. This is for when the patient has not showed up and gotten care at all, okay? That's why the history is so important with injuries. When a patient has a fracture treatment and the fracture slips out of place and needs to be reset, this is also an example of active treatment. External cause codes. External cause codes are vital for the action behind the injury diagnosis code. External cause codes are 7 characters and end with the A, D, or S. External causes are important for many reasons, including reporting of motor vehicle accidents, work injuries, sports injuries, to name a few. There is no current national mandate for reporting external causes. However, in some states like Louisiana, that do require it when an injury diagnosis is being reported. There are also some insurances that require this information as well. And I'm going to stop it right here. Even though providers are not required, and there's no national mandate unless the state or the insurance company is requiring it to report these external causes, it does not mean that we can't advocate for these external causes to be documented. Things can change at any time. We've seen this. We've seen this when COVID came along. We've seen this on a lot of other instances in the past. This does not mean just because they don't have to do it that it shouldn't be encouraged. Now, I say that it should be encouraged because, again, if this is related to a workplace injury or maybe a car accident, keep in mind we're working with legal documents every day when we're working with medical records. So if these records have to be called in for court, it should be clear that this injury is related to this incident that happened at this time. So that way there is no ambiguity, that everything is clear, and this is why. So that is very important. And if your providers are saying, well, I don't have time for that, it's just too much, put it out a little bit at a time. Because trust me, everybody runs into this resistance. I ran into this. And now all of my providers know better. They all know that they need to have an external cause code, whether it is an initial injury or they are taking care of them in the subsequent phase. Let me know how it happened. What is the activity code? The activity code is reported once on the initial encounter for injuries because this helps support the external cause to tell the full story. External causes can be to the point such as fall on stairs or steps. What was the patient doing when they fell? The activity code answers this. The activity the patient was doing often can be found throughout the HPI or even in the assessment and plan. FYI on activity codes. Activity codes are appropriate for use with injury codes from Chapter 19 for the injuries and long-term organic conditions like the ones seen in Chapter 13 in the musculoskeletal section. Activity codes are not to be applied to poisonings, adverse effects, misadventures, or sequelae, just on the initials. What is the place of occurrence code? Where or the place of occurrence a injury occurred is important to be captured in the documentation. This code is just reported once. It can be located throughout the documentation either in the HPI or the assessment and plan. Some examples of place of occurrence would be a house, hospital, farm, school, street and highway, or construction area, to name a few. What is the status code? The status code describes the status of the person at the time the event occurred. Some examples of status are volunteer activity, civilian activity done for income or pay, military activity, student activity, recreation or sport not for income or while a student. This code is reported only once on the initial encounter if the information is available. Code Scenario A. A 35-year-old housekeeper who was vacuuming the stairs at the home of a client when she fell down a couple of steps. Workup revealed a torn left ACL. Then we have our codes S83.512, sprain of the ACL left knee, initial encounter. W10.8XXA, fall on or other stairs or steps, initial encounter. Y93.E3, which is activity vacuuming. Y92.018, other place in single family private house as a place of occurrence of the external cause. And Y99.0, civilian activity done for income or pay. Bonus activity code example. This example is for when an organic condition in which an activity code would apply. A 20-year-old professional baseball player has right ankle pain that started when he runs. The patient said he had no formal injury. He has just been training harder for the upcoming playoffs. The provider diagnoses him with right ankle bursitis due to running. The code is M70.871, other soft tissue disorders related to use, overuse, and pressure, right ankle and foot, and Y93.02, activity running. The rationale for the bonus activity code example. There is a use additional note at the beginning of the section M70, soft tissue disorders related to use, overuse, and pressure, that instructs the coder to use additional external cause code to identify activity causing the disorder, Y93. Pre-op encounters for injuries. I am going to make a big deal out of this because I see coders do this all the time. They report the pre-op code and then they report the injury code with the 7th character of D. That is wrong, 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 wrong. And I'm going to tell you why. Pre-op encounters for injuries. When a patient presents for a pre-op appointment before their surgery for a injury or an ORIF, open reduction controlled fixation, for a fracture, this patient is still considered to be in the active phase. Surgery is considered active treatment. The 7th character for injury and external cause, if available, would be A for active. Remember, the Y codes are not used on subsequent visits. So we can still use the A, the 7th character of A, but we don't necessarily have to have all those Y codes on there because they are not to be reported on the subsequent encounters, okay? Pre-op encounter for injury example. The patient is a 35-year-old housekeeper who presented earlier this week who had been vacuuming on the stairs of a home of a client when she fell down a couple of steps. Workup revealed a torn left knee anterior cruciate ligament. Decision was made to perform surgery as soon as possible. The patient is here for a pre-op. Z01818, Z01.818, encounter for pre-procedural examination. S83.512A, sprain of the ACL left knee, initial encounter. W10.8XXA, fall on or from other stairs or steps, initial encounter. D, subsequent encounter. From the ICD-10-CM diagnosis code guidelines, chapter 19, section A, seventh character D, subsequent encounter, is used for encounters after the patient has completed active treatment of the condition and is receiving routine care for the condition during the healing or recovery phase. When the patient is in the healing phase, they are, recovering from the injury. This lasts as long as the post-operative period or when the patient did not have a surgery until the provider says that they are healed. Examples of seventh character D application: first visit by the physician who will be taking care of them in the subsequent phase, suture removals, dressing changes, cast or splint adjustment, change or removal, medication adjustment, follow-up visits to assess healing, and rehabilitation therapy. Code scenario D. The patient presents 2 weeks status post-ORIF for right tibia shaft fracture that was sustained after falling down a hill. Patient reports 4 out of 10 pain, and there are no other issues. The patient will continue with casting. The answer: S82.201D, unspecified fracture of shaft of right tibia, subsequent encounter for closed fracture with routine healing. W17.81XD, fall down hill or embankment, subsequent encounter. Notice how the Y codes are not used since the patient is in the healing phase of their care. Bonus code scenario D. The patient presents to the orthopedic clinic for the initial visit, status post closed treatment done in the ER. This will happen a lot. For a left trimalleolar ankle fracture after a trip and fall. X-rays done in the clinic show the fracture is in good position. We'll leave the patient in the cast for the next 2 weeks for follow-up and re-examine then. The answer is S82.852D. Displaced trimalleolar fracture of the left lower leg, subsequent encounter for fracture with routine healing. W01.0XXD, fall on the same level from slipping, stumbling, tripping, subsequent encounter. The rationale for bonus code scenario D. The application of D to the injury code in this scenario is based on where the patient is in the course of their care. Remember, even if this is the provider's first time seeing the patient, the 7th digit for an initial injury is based on whether they are receiving active treatment or not. The patient had restorative treatment in the ER. The orthopedic clinic is seeing them for the follow-up. So that's why even if it's their first time seeing the patient, they're going to have that D, because if they continue on and they don't do anything else, even if they change the cast, it's still fine because you can still have cast changes in the subsequent phase. If they're not planning to take them back to the OR to do an open reduction internal fixation, this is absolutely going to be a subsequent encounter. Okay, so something to keep in mind. S for sequela encounter. From the guidelines, 7th character S, sequela, is for use when complications or conditions that arise as a direct result of a condition such as scar formation after a burn. The scars are a sequela of the burn. When using 7th character S, it is necessary to code both the injury code that precipitated the sequela and the code for the sequela itself. The S is only added to the injury code, not the sequela code. So if it's pain, you're not going to put S at the end of the pain code because that would make it invalid, right? It is only going to go on the injury code and the external cause, the S. The S is only added to the injury code, not the sequela code. The 7th character S identifies the injury responsible for the sequela. The specific type of sequela is sequenced first, followed by the injury code. Then we have S sequela encounter continued. The sequela of an injury can occur at any time. if the condition, pain, scarring, post-traumatic osteoarthritis, etc., is a sequela of the injury, there must be a causal relationship documented in the record or encounter to link them. Examples of seventh character S application: post-traumatic osteoarthritis due to a fracture, scar following a burn, pain from a healed fracture, and an ingrown toenail following a toe injury. FYI on sequela: a minimum of 3 codes are needed when fully reporting a sequela: the manifestation code, for example, the pain, post-traumatic osteoarthritis, or scars, the injury, and the external cause. The sequence will always be manifestation first, followed by the injury code and the external cause code. Remember, the Y codes, activity, location, status, are not reported with sequela. Code scenario S: the patient presents with right ankle pain as a result of a right bimalleolar ankle fracture sustained due to a fall sustained 4 years ago. Okay, M25.571, pain in the ankle right, S82.841S, displaced bimalleolar fracture of the right lower leg, and W19.XXXS, unspecified fall. Rationale for code scenario S: the right ankle pain is directly linked to the fracture. The specific fracture was also identified and how it happened. For sequela, injury, and external cause codes, the seventh character will always match as S. Remember, the injury code for the seventh character of S is never reported by itself. It must always have a manifestation coded first. Follow-up code. From the ICD-10-CM coding guidelines, the follow-up codes are used to explain the continuing surveillance following completed treatment of a disease, condition, or injury. They imply that the condition has been fully treated and no longer exists. They should not be confused with aftercare codes or injury codes with a seventh character for subsequent encounter that explain ongoing care of a healing condition or its sequela. Follow-up codes may be used in conjunction with history codes to provide the full picture of the healed condition and its treatment. The follow-up code is sequenced first, followed by the history code. When the patient has completed all of their treatment out of the global period and has no other issues, the follow-up code Z09, encounter for follow-up examination after completed treatment for conditions other than malignant neoplasm, plus the history code, injury, traumatic fracture, both or other applicable, would be applied. This is because if there are no other issues, these codes would indicate why the patient was seen. Examples of when follow-ups plus history apply: follow-ups outside of the global period, follow-ups to ensure proper healing of a non-surgical injury. FYI on follow-up: the follow-up code is not to be used in the global period. Any applicable injury or fracture code, history codes can be used with the follow-up code, and Z09 is sequenced first before the history codes. And I'm going to stop the video right here because I am going to be running out of time soon, and I want to do this last section organized. So I will go ahead and wrap this one up, but thank you guys for joining me for the first part of this presentation, and we will continue on in the next video. I'll see y'all again. Bye.